after 4 very interesting sessions, we are going to close the conference with an even more interesting roundtable, which was a secret roundtable. Everybody was asking about the content of the roundtable. Nobody saw the names, nobody saw the topic. So now everything is disclosed to you, to all those that remain until the very end. No? Nothing better to guarantee that the roundtable is a success than counting with the 8 distinguished speakers that we have had today. Thanks again for participating in the conference and in the roundtable. And I want to use the opportunity to extract more knowledge out of you, and in particular to address you 7, 8 very relevant policy questions that we face in our day-to-day life. So I would like to take notes of all your knowledge and write a report on aging, pensions, health, many of the issues covered today. So apologies because I missed part of the session, so perhaps I'm going to repeat some questions that were already addressed in one of the previous sessions. In any case, I assume that the debate was not completely exhausted in the session, so it would be nice to extend the discussion. Just in terms of logistics, I'm going to launch the questions. Any of you can jump in to answer to give your ideas on the topics. And also the audience, before moving to the next questions, also the audience, please interact and provide your views on the topics. Okay, first question to all of you here in the roundtable and in the audience. No? I know there is some evidence pointing to the importance of having a very active life at retirement. Very important also to have a healthy retirement to extend your life expectancy. And in this regard, I would like to know your opinion about this literature, about this evidence, and related to that, some hints, some comments about active retirement, the possibility of complementing the pension benefit with work. So in this question, but in all the other questions that I will pose to you, if you can give us some academic evidence, but also some ideas of what has been the best practice in some of the countries that you know well, in terms of fostering, in this case, active retirement in the Spanish labor market or among the Spanish retirees, no? And also, to make the question more comprehensive, what is the evidence that you have or the evidence that you know about the incentive to postpone retirement? Do they work? What are the key elements in the schemes approved in other countries that make them work or fail? And this is an important element of the Spanish pension reform that was approved some quarters ago. And, obviously, there is a lot of uncertainty about the potential impact of these incentives. So I would like to know your opinion about what are the main elements of these incentives. We know that in some occupations, these incentives may not work, and even if they work, there could be a death sentence for those, no? Like postponing the compulsory extending working life in some occupations could be damaging for health. We know that there is also evidence on that. So again, a lot of questions on the issue of pensions and health, postponing of retirement, active retirement. So any of you jump in?
Can I start?
Of course.
I think one of the things when we think about these things is we need to think about differences between individuals. And I think the differences between individuals underlies some of another European attempt to increase the pension age, which was President Macron in France's attempts to increase the pension age, not by very much, by some European standards. Led to, and I was part of the Macron Commission that kind of looked at this. And I think one of the issues is when you have a blanket policy that says everyone has to go from 60 to 67, there are some people that really want to embrace that. And some people, as Katharine was showing, who are in a position to want to work. But there are other people, particularly at the moment, who are at the end of working lives, which have been hard manual working lives, or incredibly boring, repetitive lives in work, who don't want to work and whose health conditions, because of their social conditions and their economic conditions, are such that actually extending working life is the last thing on their list that they want to do. And they also, because of the big disparities in age of death across social classes and income classes, they're not going to live for that long. So I think that when we design policies and when we design incentives, we in some ways want them to be incentive compatible for a range of individuals and not just all in, not the average individual. So that's my kind of view on this.
Can I go in on that? Because another way to think about this design issue is, it's going to be a very straight up economics sort of argument to start with, is distortions versus neutrality. So, the way a lot of pension plans work, they do actually distort the individual's labour supply decision, either by encouraging them to stay in work because of the way in which they will accrue pension benefits if they do, or leave work because if they're not going to get the full reward for their hours work in pension. So, one scenario would be to say, well, we want to get rid of the distortions, and in fact that's been a lot of what the DB to DC reform was kind of about. But if you do that, of course, then you're going to rely on markets, undistorted markets, to sort of deliver the outcomes that you need. And then we get into this issue about, the demand and supply for older workers and are the relevant set of jobs kind of really there to provide people with what they need. And if they aren't, will the state step in? So it does become very complicated. But one thing I think I wanted to add to that, which comes from Carol's comment, is that I think too often we just think about pension systems on their own. And maybe, if we're lucky, someone might think about the pension system as a system including the healthcare system, but that's pretty rare, to be honest. And really, I would argue that the three main pillars of old age support, pensions, healthcare, and social care, and we haven't spoken hardly at all about social care today, no one really thinks about them as an interdependent set of systems which have similar pressures. And sometimes if you just fix a pension system for incentives, someone will just turn up in a different system. And so I think all three pillars are affected by the same shocks and same behaviours. And reforms in one can actually lead to consequences in another, especially if you think different types of work are good or bad for your health, or if you think certain types of health care leads to dependency on the social care system. So I think that, first of all, we do want to think about distortions, but second of all, we've then got to say, well, how would undistorted choices play out with regard to these three pillars as a system rather than just in the pension system?
On that, I just wanted to pick up on what both of you just said. The push with respect to public pension systems has been towards raising the retirement age, which, as Carol pointed out, it has different implications for different people. One thing that I think is less controversial, maybe, is thinking about not the stick, I guess. You can't retire until this higher age, but thinking about the carrot, if you will, which is, what are the penalties for continuing to work in the retirement system, and could you eliminate those penalties for continuing to work? I think there is some good evidence from the U.S. context that eliminating the penalty for working past the normal retirement age in terms of the Social Security benefit that you can collect had a significant effect on employment. If people knew that their retirement benefit through the public pension wasn't going to be reduced if they kept working, then they would be more likely to keep working. And I think, if that's what they want to do, that has some clear advantages. And I think it also has some advantages in terms of money coming into the Social Security system.
Then make an empirical point, a theoretical point, and then a bigger point. On the empirical, because I think we have to be really careful when we're economists talking about aging society issues, because we often fall into the trap of saying, about active retirement. And we talked earlier about GDP as a misleading measure. David Canning's colleague, David Bloom's done a lot of very good work measuring the contribution outside the marketplace that older people make. And they're very heavily involved in caring both of their partners and their children. They're more likely to be involved in social activities. So they are active, just it doesn't show up in the GDP numbers. And that whole notion about old age dependency ratio is very damning about the contribution older people make. Secondly, I think we're all in alliance that the challenge we've got is there's just enormous diversity in how people age, and much of that is correlated with socioeconomics. So the idea of a single retirement age is clearly just nonsensical. And one of the really big policy problems we've got is chronological age just isn't a great state variable for making decisions. And we sort of assume that everyone over a certain age is the same. But as we live for longer, unfortunately, diversity gets greater as people age. And I think we've got to really start saying, well, do we just think of age even as a reliable indicator? We've got to think about this group who are struggling and this group who aren't. University professors can carry on working to, whatever age they want. They're doing great. They probably don't need much in the way of support. So we need to sort of think about policies as we do before retirement age, which is age isn't the key thing. It's the person's circumstances, much, much more. Then in terms of retirement, we do know that if you're working in a physically active job, the longer you work, the less you live. If you're working in a less physically demanding job, the longer you work, the longer you live. There is something about engagement and purpose that makes this a good life. And I just want to finish on that because I reread Simone de Beauvoir's book on old age. It's a great book. And she wrote it in the 70s, and she's so angry. And there's a sort of anti-capitalist point there that says capitalism doesn't know what to do with old people because it's made them retire, it hasn't got a job. What's the point of them? And she says if all our old age policies to just say, well, have you got a pension and have you got a hobby, we're really failing older people. It's much more about the purpose of life. And I sort of say I think that should be at the heart of things, and David's reference about welfare. And of course maps in with how do we make the most of these extra years.
First let me say I completely agree with this idea that we need to recognize diversity. It's huge, it's growing. And thinking about what the ultimate objectives are, and that's also quite complicated. One point that I don't think has been brought up that seems important to me is that although individuals, for example, can save for their retirement, in a sense for the economy as a whole, we're consuming whatever we're producing at that moment. And so many of the issues that we're facing, if we have fewer people working, we're producing less. That may not be a bad thing, but we need to make sure that fits with people's desires. But so to the specific point, I like the idea of having a system that is neutral, more neutral in terms of you can choose your retirement age. If you choose a later age, you're going to get presumably a larger annual benefit. Hopefully it's more or less actuarially fair, although that will never be completely true. But I would also add that needs to be combined with some real education for people to understand their choices. So one of the things I believe in the U.S., we have a lot of people, you can take Social Security starting at 62, but it's substantially reduced versus delaying. And I think many people don't really understand what they're doing when they do that, and so they face in later life they could be much worse off than might be optimal from their own point of view. So I like kind of the neutrality of when you choose your pension age, but combined with some real educational efforts to help people make decisions that are best for them.
I think we all agree on the fact that we should give more freedom at older ages, and also with respect to the decision of retiring. And that is also a byproduct of the fact that the type of aging we obtain and the increasing longevity was very much associated to the fact that many diseases that were before terminal disease were transformed into chronic disease. So we have people aging with long-standing disabilities and problems, that they carry health problems. So they live longer, but they have, and there is the heterogeneity in the population at that age is enormous. But we have to, in doing that, I think there are two problems that should not be overlooked. The first one is a political problem that I experienced when I was working at Italian Social Security. I was indeed endorsing at the time to create as much, because we had a system which was half DB and half DC. And actually there was this paradox that the DB system was only allowing for way less freedom in choice in terms of the age of retirement than the DC system. So we had generations that were forced to retire later than the generation to come in terms of freedom of choice. And so I was suggesting that we could have done something to increase freedom already for current generation, provided that clearly we were to do some sort of actuarial adjustment to make the thing sustainable. And the strongest opposition I got from this was from unions, because they prefer to have like compulsory things. So you have a compulsory age of retirement rather than this adjustment in benefit levels. And that, I think there are certainly reasons of communication and other things, but there may be something else that we perhaps are overlooking, all of us, and this is monopsony power and the power of employers. So the decision of retiring is not a decision is only a labor supply decision, can be to a large extent something which is induced by the employer. So there is a risk, if you allow for more freedom in terms of the decision to retire, to have many workers that are forced to retire, and they retire with a very low pension, and they have to cope with the rest of their life with a very low pension. So that's something that sometimes we are not considering enough, in my view.
Yeah, I would just say that the social norm issue I would take account of as well. It's not just about the incentives. And I agree with this idea that people should be freer to choose when to retire and make a trade-off between retirement age and pension income. But the social norm of what the normal retirement age, early retirement, the labeling matters. It shouldn't, but labeling one as normal and one as early, or one as normal and one as late, makes a big difference. And setting the social norms, I think, is very, very important. I would emphasize this point again about the heterogeneity of people. There is this issue that if you're worried about long lifespans, it's the richer people are living long lifespans. And the poor, particularly the manual laborers, have actually got quite a short life expectancy. And so forcing them to work longer isn't really fair. And maybe adjusting the age by income decile for different life expectancies by decile, but taking account of the heterogeneity of people and the fact that you're sort of reinforcing inequality perhaps by changing these retirement ages, I think is very important.
Great. Yeah, I think one aspect that I wanted to talk a little bit about is, the welfare of people as they age. As we have, so far, mostly put more focus on kind of the economic consequences of an aging society. But I mean, it came up through many of the talks and the discussions. And I think the idea is that we talk about that, we want to know about healthy life expectancy rather than life expectancy. But I think a big aspect is just not physical health, but also mental health, or just people's well-being. And I guess one thing what we should do is we should just measure more and for example, measure the subjective well-being of older people. And I've done some research on happiness, and I've stopped doing research on happiness because it's tricky to measure it, and you always get into all kind of issues with referees and so on that make you very unhappy. And they're like, I will stop work on happiness if it makes you unhappy. But the issue with kind of measuring, am I an 8 or you're a 7 and all of those things, this is more at the margin. I think what we just want to measure, we want to account for like depression and like really like people feeling miserable in old age, right? Because I think that that does happen a lot. It happens because of health, but also because of isolation, because of mental health, and so on, right? And maybe also just like about like, you know, you're coming closer to the end of life and all of those things. And so I think we should just measure that a lot, and then we should like, because all of this is like new man's land, like it's we haven't gone through that beforehand as a society, and we should just like think about or try to find out like what life arrangements work for different groups better or worse. And just like one last example, so when my dad retired, he was really crushed because his job was like really his identity and so on. And we really noticed this. We have 4 kids, and we noticed that he was like so like insecure suddenly, really not himself anymore. And then we gave him like this box with like swimming gear, because he has been swimming as a college kid, but not since then. And, you know, it was like a membership and goggles and so on. So then he like reluctantly went back into the pool to swim. And this went on and on. Now 10 years later, like he's beating me. He swims like 5 times a week. And he has developed a really great sense of aging, because for like swimming races, that's typically in age groups. And so he's like, he couldn't wait to turn 75, because now he won, I think, like 4 different German titles. And he's like, and once I will be 80, there will be even less competition in the next age group. And he even speaks himself of like swimming as like being this happiness machine. And of course, that's not, you know, wouldn't be for everybody. Probably you need to have like some swimming skills or so on. But I could just imagine that there are very different paths that people can take. And if we learn about those, and learn about like how to make you know, old age fun and nice and fulfilling, there could really be a lot to gain. And of course we have to couple it with those economic discussions about like how we finance everything. But a lot of those things also are not very costly in a way, right? But like they get costly when people get depressed and when we run through problems. So I think like the measurement of people's well-being and like identifying, positive aging paths, that's good.
Okay, thanks a lot. Is there any views on the Jaffa?
One issue that hasn't come out so far in the discussion about the legal age of requirement is that a compulsory requirement is a mechanism for firms or employers to get rid of older, perhaps not very productive workers, perhaps people that have reasonably high wages because of seniority. And so this is an element that sort of perhaps should be taken on board. I mean, especially in continental European countries where you have very strong employment protection legislation that makes it very difficult to get rid of workers.
Please.
Lines there that I think it was James who said, well, we haven't even spoken about like the social part, and David, you spoke about like fertility. We can't force women to have children, but an aspect we haven't spoken about at all is, I think this is going to be the first time in history that we're going to have a lot of old people who are alone for many, many years because they didn't have kids, or our generation is not having kids. And I think this is something, I don't know, we haven't probably even thought about it. I know the UK has studied stuff like the loneliness crisis, but that's the only example I'm aware of. I don't know, are there any thoughts about, this doesn't seem to be something we can solve with the social security pension system. You know?
Well, that's certainly true. Just can I? So I think there's aspects to pick up from your question without maybe, I'm not sure I can answer it. But firstly, you know, we've not really talked much about families. And we've talked in places in passing about the intergenerational connections between families, bequests, and certainly the care that families can provide and the social support. And I think, you know, a lot of the narrative around aging presents it as a kind of zero-sum game between the generations. Certainly we do when we're thinking about jobs and we're thinking about sustainability of tax systems. And of course, that's not there's much more flows up and down between the generations, and actually those flows can be pretty quickly undo all the effects of policy. So, and that's all. You just have to look in the developing countries to see how much informal insurances are there compensating for the lack of a welfare state, and that would be exactly the same case. So a lot of these sort of fundamental pressures about how to support an elderly population, if they don't turn onto the government, they're just going to turn onto families, and that's going to pattern these pressures in a very different way, in which the government can't control, probably making things much more unequal. The only people are going to be on average poor. The children of the parents who are ill are going to not be able to work, and the parents are ill are probably poorer on average. So that means children of poorer parents can't work so much. So the inequalities almost get worse if you let the families have to do all that insurance, as opposed to the state, which can do it in a more managed way. So the way in which we think about families and the older population is absolutely crucial, I think. And there are lots of issues why you might think some people might legitimately want to stop work to help grandparenting or stay in work. So I mean, I think that's something we haven't spoken about. The loneliness thing in particular, I think, is really interesting. We do have a lot more lonely old people than we had. But that's actually, this is a good example of the narrative stuff that David and Andrew were talking a bit about. Actually, older people are, at a given age, older people are much less likely to be lonely than they were. It's the same with dementia, it's the same with disability. Actually, life as an old person is getting better at any age. 80-year-olds are less lonely than they were. The reason we've got more lonely old people is just that we've got more 80-year-olds. And the people who deal with the system, who are, the coal face of the National Health Service or the mental health charities, they're seeing lots of loneliness, and they describe it as a pandemic of loneliness that is driven entirely by demographics. And then we lose this positive narrative that Andrew and David are trying to say, which is actually old age is a less lonely place to be now than it was in the past. Now, I'm not saying that in 50 years' time, when people haven't got grandchildren or whatever, it won't be again. But I think it really illustrates this difference in the positive narrative that you get if you look at individual lives, and the negative narrative that you get when you, as a policymaker, you have to legitimately focus on the system. I mean, the National Health Service does have more lonely people than it did. It does have more demented people than it did, and it has more disabled people than it did. So it's very hard for them to present that as a positive narrative. But you have to sort of look beyond that, because for any, and that's true even for any groups of society, pretty much, that is getting better. So, I agree with you that whole idea of the family and loneliness at older age is a crucial part of well-being. But the question is getting that narrative right between the pressures in the system, and actually, still, even there, people are doing better at the moment.
Oh.
Sorry, long answer.
We all agree, I think, that has to be able for early retirement, a person that does physical activities. But I'm very concerned about the white-collar occupations. No? Now we are becoming out of date very quickly, no? And probably there are issues, like Rafa was pointing out, no? Of high salaries of this part of the population, no? And probably the decrease in salaries is much higher, no? for that population. So to me, it's kind of difficult to think on this early retirement on income, no? Because of this reason. No? How do you think on this?
Another question here, please.
Thanks. I mean, great conference. I was a little bit surprised that we focus a lot on pensions and the financial issues regarding the sustainability of pensions, or how are we going to deal with that, and we didn't touch upon the cost of healthcare and how, longevity, how much it's costing us, and the decisions that we have to do in terms of administering our society's budget, in terms of managing pension risk, health risks, etc., where health, it's a huge cost, and also significant. it's extremely steep in the last 3 years of life, no, or something like that.
Okay, I'm gonna select my next questions. I had many questions, but yeah, sure.
Can I just? It's just an extra thought on the health cost. That I think one of the things, and it kind of reflects, in a sense, the tone we've been talking about in pensions, that we rely on a health system to mop up an awful lot of things that have appeared. So, you know, once you get diabetes, then you enter the health system. Before you get diabetes, you don't enter the health system, but you don't get diabetes like overnight. You get diabetes because of choices or restricted choices that you've made. So I think when we're thinking about healthy aging, we actually need to be turning the whole thing round and be thinking about things like food policy, exercise policy, and actually focusing a lot more on thinking about changing young people's behaviors before they start to get non-communicable diseases, because those are the diseases that people die from, and those are the diseases that health services across the developed world, and indeed other bits of the world, are having to focus on. And those diseases, non-communicable diseases, are all a product of people's lives, lifestyles, incomes, and what they can buy with their money and what's viable. And so I think if you think about that, it leads you much more to thinking about policies to maintain people's health rather than policies to prevent them getting these illnesses, rather than putting all your money into policies that treat those illnesses.
And can I pick up on both this and Raphael's point about retirement? And these are both great examples of institutions that worked when the majority of people didn't live to become old. And so we have to change, because now the majority of people are getting old. And you know, Carol's stressed the health sector. I mean, we don't have a health sector, do we? We have something that treats illnesses. I think one of the great ironies of life is the World Health Organization is in charge of classifying diseases. Again, I'll give another quote. Auden, the British poet, says, "Health is a subject that medicine knows nothing about." And that's a bit harsh, but it's true. And you know, when we get diseases, we intervene, and that's great. But age-related diseases, you can't, at the moment, get rid of them, and they just compound and get another one. So we've got to treat this as a health issue, and suddenly health becomes something much more outside of the health system. So we need much more, and it's the products we buy, you know, town planning, but also we need a lot of innovation in public health and prevention, because we've had loads of innovation in intervention, we just need a bit more innovation there. And then on retirement, I kind of get your point, because the history of retirement was companies liked it because they could get rid of older workers. And particularly the Industrial Revolution was happening, and there's a lot of our ageist stereotypes about older people being unproductive come from a world where education was increasing. You know, my parents left school at 14, my grandparents 10 and 12. And so, you know, when the Industrial Revolution was happening, older people were less productive in all sorts of ways. That education increase has leveled off, so actually there's not now big differences in education between older and younger workers, which suggests that exit mechanism is less needed. I'm not saying it's not needed, and of course in some countries, if you haven't got an exit mechanism, a second best is, at least we've got retirement. It's very much a second best world, that. But of course, actually in most countries, it's the state pension age that matters for retirement. Retirement is illegal. Oxford University is currently going through the courts because they're trying to enforce academics to leave at 67, saying it's discriminatory to the young if they don't, and they're losing the case basically. So retirement is in most countries already illegal. It's the state pension age that really determines. But I think then what we have to think about is, how do we think about health and education, investing in older adults as a source of economic growth? We think about it amongst the young, but not amongst the old. And then also, how do we stop wages just rising with tenure? Because that's the real problem. It may not be productivity flattens, although we saw the chess stuff, but actually if wages keep rising, then you want to get rid of people. So it's how we change that wage profile. And these are all profound changes, but we're going to have to find a way to deal with them, I think, rather than just have a somewhat second or third best exit mechanism.
I know you wanted to get to your next question, but I do want to pick up on that comment. I was going to make the same point, that part of the problem is that we have this expectation that as somebody gets more seniority, that their wages are going to go up and up and up. And at a certain point, if we could normalize that people might step down from the level of responsibility that they had before and take a cut in pay, that could accomplish a lot of things. It could let people keep working in less demanding jobs. It could better align pay with current contributions. But it's hard to get people to think that's just a really different way of thinking. But I agree with you, it's something we should be thinking about.
Well, I see that my first debate was very successful in creating discussion and participation. So let's switch gear a little bit so that we cover many of the topics that were discussed already in the sessions. Let's talk about the financial instruments for retirement. Precisely this week we published, it was made by Olympia's team, we published the survey on the financial competencies of the Spanish population. We asked people, 8,000 people in Spain, 3 very simple questions to understand the knowledge that they have about inflation, the compound interest rate, and diversification of risk. Only 1 out of 5 adult Spanish, knew the answer to the 3 of them. Only 1 out of 5. So how can you expect that these people is, by the way, this is slightly better than in 2016, still slightly worse than the average in the OECD, but this is disappointing anyway, no? So how can you expect these people to buy an annuity? Or how do you expect these people to buy a reverse mortgage? And this is my next debate. So you come from the UK, from the US, many of you. Reverse mortgage is a big market in the US and the UK, big compared with the market in any other place, but still very small relative to the potential market in the US or the UK. So what do you think about this product? What elements do you think it could be good to extrapolate to other countries? And in particular, what do you think should be the role for the government in terms of boosting this product or preventing people from getting into this product? No? In the US, is the reverse mortgage program, it has a content of government sponsorship. So what do you think about this?
Do you want to go first, Chris, or shall I?
Yeah.
Okay, I'll start. I think, there's 2 things going on. One is that the population, regardless of their age, are financially, I'm not going to say innumerate, but certainly a lot of financial calculations come quite difficult to most of the population. And I think that, in an ideal world, there would be some emphasis on some simple financial planning and financial education throughout the education system. There have been various different experiments about this. People have tried it in schools, so it's quite hard to make these lifetime planning problems relevant to kids in school. But also, employers, I think, have a role. So I think first of all, you need to build a platform of financial education. In fact, I'd even go further, a platform of skills, the education system needs to build a platform of skills on which people can continue to top up their skills as they age and as the world changes. So, you need to think of an education system that prepares people for the rest of their lives and the changes in the world that will happen during the rest of their lives. And I don't really think we think of education like that. We sort of think about it as like we just deliver, the curriculum and then we expect people to go about their lives. So I think that there's a little bit more of a lifelong agenda when it comes to skills and training, I think, and employers can be part of that. So, but, this isn't going to solve the problem. And there's another issue is that even if you had that, as I was talking about earlier, and some other people, also talked about it, there is going to still be some age-related decline. So I think you do have to think about designing products around the skills of the intended recipients. And, you know, financial markets are very good at doing this. It's just governments that are bad at it. It's very, years ago, I'll be quick, but years ago I participated in a study with a social psychologist, which was all about getting people to think about their retirement. And we contrasted the adverts that retirement pensions firms were doing on the TV, which were kind of, you know, somebody was holding a person as they went through their lives and say, look, come with us, we'll take you on this journey, which ends up with this incredible fulfilling retirement. You know, the narrative was, you know, a positive experience, you know, being sort of helped by the institutional, you know, the financial company. The government at the time had this person with a pair of binoculars saying, retirement is far away, you've got to start thinking about it. And it's just, the governments just don't think about their products in the way that the financial industry does to try and make them salient for the people that they're trying to sell them to.
So I want to agree with James completely on one point and not so much on a second point. I think this notion of sort of financial literacy starting very early, so I'm not sure when, but, you know, throughout your schooling and later, you know, starting with balancing a checkbook, but thinking about, you know, investments and returns and all that. I think actually one thing, at least in the U.S., kind of more advantaged families tend to give their kids that, and they tend to do better. Not always, but unless ones don't. But the other thing, when you talk about products like reverse mortgages and annuities, I see a couple of issues that are key. One is they're complicated, and so even people who have a reasonable amount of financial literacy are going to find it tough to figure them out. And so I think you need tools that, yeah, make it very clear, you know, pictures or software where you can put in your specific situation and get an understanding of what the outcomes would be. But the other piece of that, and I don't know exactly how you do this, it's going to be tough. The private sector may be very good at doing that, but it's not clear how good they are doing it in a trustworthy way. So I think one of the concerns, you know, I get a reverse mortgage, am I somehow going to get ripped off? Or I get an annuity, and now the company is going to go bankrupt at the time when I might want to get the money. I think you need, you know, and I think there's a key role for government in trying to help with that, because if people don't understand these products or they don't trust them, they're never going to do it.
Can I just come back? I mean, I totally agree with that. One thing I would say is that in Britain, and I think in the US, you know, the way in which regulators can regulate the production of statistics about certain products. So, you know, we had a lot of problem with very high interest rate loans, and the companies weren't sort of saying it was very hard to figure out that. And then if you regulate the way in which products have to be presented, and that's a sort of typical example. But I was more thinking that the government needs to just start thinking in that way about their own products, if you like, as well as in terms of regulating industry.
Can I reflect on something which picks up on Chris's point, which is there's a kind of moral hazard problem with quite a lot of these products that I think people are very afraid of. So it was like in the UK, there was an attempt to, for example, get people to sell their houses in part in return for nursing home care. And I think people were really afraid that if they did that, the nursing home care had an incentive not to provide very good care so that they could get their hands on the homes faster. Now that may or may not be true, but that's something that people, particularly I think people who are not very financially literate or don't have many resources, this is their only resource, are kind of worried about. When you do a reverse mortgage and you have no other savings other than your house, you are worried about the trustworthiness of the industry that is going to sell you these products. We've had many scandals in insurance industries. We've had many scandals in financial product industries. We have many loan sharks who lend to people at 35% as their lowest rate of interest at a period when it's zero. And I think people are genuinely afraid of some of these products because they, A, don't understand them, but more, they think that the suppliers have some other motive.
I was trying not to say anything on this, but I served on the board of the UK's regulator after the financial crisis, the FSA, so I try and blot the memory out of my mind, to be honest, because, wow, being a financial regulator is hard. The only thing I'd say is that, you know, all the challenges we talked about, a financial sector that missells products is not a new one. So I think, you know, we've got an experience of this, and in general, what I think regulators do is that if you have a lot of money, they assume you're smart, which I'm not sure is true, but they do. And then they basically restrict the product space for everyone else and say these are okay. And I think that's really what we have to try and do. What are the key products that the financial regulator would say, I don't mind these going out at scale, and find a way to support them, and then the private sector will market them. But I think that's, in the end, the way you deal with it.
Yeah, I would argue for, instead of like trying to inform people more and like continue wondering why they're not understanding it well enough, why they're not planning enough, like go much stronger on defaults and just like maybe have like a council of whatever, social sciences, economists and financial experts just agreeing on like, hey, this is what is a good standard, you know, make this the official standard, make it a trustworthy standard. Because I just think about, for example, my personal experience. I mean, on the one hand, you know, retirement savings, there's some defaults from my employer. We met actually once with a financial planner, but in general, like, I don't have an idea of like, what do I really want, what do I really need? And something even simpler, health insurance, right? It's something that I have to pick. It's such a pain, like every year again, like if there's a life change, now with a second kid, what do we do? I asked some other, you know, I'm a health economist, but I asked another healthcare economist to do this. At Northwestern, it turns out they have like these different plans, and one plan was poorly designed, and it was a plan you should never pick. Like under no circumstance, there's no preferences in the world that justify that plan, but it's a little bit more expensive. So actually many professors, especially the health economists at Kellogg Business School, they all picked that plan. And then if you see that, you think like, hey, maybe that's just like something, it's too complicated for people, they don't have time to look into that. And I'm sure that's even more the case for retirement stuff, retirement savings. And maybe the best is just like to have like some other people to decide, and you could still, of course, still have options to like opt out of that. But I think, yeah, putting too much weight on and like just like you know, like wondering about like why people are so rational if we are all ourselves, you know, falling in this category as well. Maybe better way forward is just like, yeah, strong defaults, and people then still could probably re-optimize if they wanted. But I think most people wouldn't want to, especially if the default is a trustworthy one in a sense.
I was going to make that same comment, that it's sort of getting back to David's point about social norms and what people expect. You know, if you have stronger defaults, that would give people signals, and then they could always opt out. But you know, defaulting people, for example, into using a portion of their defined contribution savings to buy a longevity annuity, or you know, whatever it is. I don't know what it's going to be, but I think that would be valuable. I was going to make a comment on the trustworthiness of insurance companies. I don't know what the situation is in other countries, but in the U.S., all of these insurance companies are regulated by the states, and the states maintain guarantee funds, so that if an insurance company goes belly up, that there's a guarantee fund that will pick up a lot of the liability that company has. But the companies are not allowed to mention that in their advertising. And there is a moral hazard issue there. If you let them advertise that, then that, you know, could undermine how careful they are about managing the funds, and they could still get customers. But I think you could deal with that through regulation. So maybe that's just one aspect of explaining more carefully to people what the risks and potential returns are.
If I could just add, though, that worked, you know, some of these things will work for one kind of program and not another. For example, I don't think you can default people into reverse mortgage. No. I would never want to do that. But also, if you look, yeah, I agree, having, you know, a part of your defined contribution pension default into an annuity, that sounds great to me. But if you look at long-term care insurance in the United States, pretty much nobody takes it. But if you talk to people who have, almost invariably the experience seems to be bad in terms of when they really need it. They discover the policy doesn't cover what they think it would, or that the insurance company just tries to get around paying it. And it's complicated. I mean, some of these issues, I think the answer is going to be government is actually better. You know, we're going to provide that publicly in some way.
Any point in the audience? Any views? Okay, this topic was not as successful as the previous one, so let's try to change it again. Coming back to health, it is a fact in Spain, I think also in the UK and in the US, that sick leaves are increasing significantly relative to pre-pandemic levels. This is something that doesn't have to do with the more acute phase of the pandemic. Once the pandemic has been surpassed, we have seen an increase in sick leaves that seems rather persistent. And this is partially explaining this very acute difference in terms of the labor market dynamics in Spain and in Europe in general, in terms of hours work, effective hours work, and a number of employees. No? So how do you see this? Is this something? Do you have an explanation for this? Is this worrying you? Do you think it's related to post-COVID effects? Do you think it's related more with, let's say, a more structural trend in this? Well, we know there is a structural trend in hours worked by employee, which is going downwards, and in theory it should go even downwards in the future, no? As productivity goes up and we value more leisure. But how do you see this trend? Is this worrying for you? Anyone but James? No, sorry.
No, I think there are several explanations for the increase in sick leave that several countries experience. The most intuitive is related also to the changes in sick leave provision. That most countries during the COVID increased the generosity of sick leave. And they did it for very good reason, of course, and mainly to also avoid the presenteeism. So there is clearly a response to that, and as well as stronger awareness for the employee and their employers that the risk of contagion is way stronger. So clearly people are in a way induced to stay at home under these circumstances. But the driving force to a large extent has been increased generosity in several countries. There were countries that had very the sick leave regulation were extremely tough and did not compensate at all people staying at home and being sick, and they introduced rules that have changed. So I think one of the something that I've been also studying and investigating is very hard to act on the design of sick leave, strictly speaking. It's way better to work on the controls related to the sick leave. I've been studying the effect of home visit to people being sick, and they seem to be really the most effective way to improve and to deal with moral hazard problems, but as well as risk also presenteeism, because they are extremely selective and basically, and at the end of the day, they are not that costly, at least compared to the incentive that you create for people to manage better this institution. So. Since I'm talking, let me just say two things about what was said before. On the mandatory retirement, what Rafael was saying, this institution was not relevant in most European countries when we had the DB system, but it was not binding to a large extent. We had people retiring as soon as possible. It is now, given the change in the design of a pension system, becoming more relevant. So I agree that the way out of this is to change the collective bargaining system and the rules there, and not reward the seniority as we were doing in the past. A separate issue is related to the public sector. In the public sector, that is maybe the only way to have some turnover, as we know pretty well. And on the issue of financial literacy, what worries me is that PIAC data suggests that over the working life, there is a reduction in the PF data are quite worrying in this respect. There is a clear reduction in capabilities to do very simple calculation by people, and so that given the type of problems that this morning were also mentioned in the decumulation phase and so on, makes me extremely worried about that. If we move to more freedom, more freedom, in that respect may backfire. And there is evidence instead that forcing people to retire later is forcing more training, people to invest more in human capital. So there is a trade-off there that we should duly address.
I can talk about sick leave, if you like. As always, there's something in the UK about this. It seems we did have very low, internationally speaking and historically speaking, activity rates for older workers coming back after the pandemic. And there's been a bit of a debate about, is that early retirement? People realized they didn't like the jobs, or more probably they didn't like commuting and they didn't like all the things that go along with their job. Is it because they're more likely to be on hospital waiting lists, because waiting lists have gone up post-pandemic? And to be honest, there's no real story there. It doesn't seem to be early retirement post-pandemic, and it doesn't actually seem to be much sickness either. It's sort of a transitory way in which some of these things are measured. I think the issue of sick leave, though, is even before the pandemic, is a really interesting one. And I was on a panel, a policy advisory panel for the Department of Health some years ago that was looking at sickness absence. And the reason it was looking at sickness absence was that this was one of the early events on the pathway to a health-related early retirement. Essentially, you'd begin to see health shocks. Some workers would, maybe, like Carol was saying, do things to prevent their health getting worse. They might be just attached to the labour market, so they just might carry on working regardless. But for other workers in other types of jobs, these health shocks started as sickness absence, and before you know it, they were kind of out of the labour market on invalidity benefits or disability benefits and retired early. And I think it really is an interesting thing to study on that pathway. And one of the things, it goes back to my original comment about these interdependencies between the health and the pension and the social care system. One of the things that we talked about there is in the UK, we've basically taken away any form of occupational health. By which I mean employer. So there are parts of the health service that work with patients to allow them to continue in paid work. And sometimes there are parts of employers who have occupational health therapists to allow. And in the UK, we've really taken that away. And I think that's a really interesting issue, actually, to think about that nexus between health and work early on in people's lives, when in their 40s and 50s, when they're beginning to get a few chronic conditions that are probably mild, that can both work with the employer to stop the health getting worse, but also work with, whether that's through stress. I mean, the big thing now is mental health, of course, and that's a massive occupational health issue. And employers are beginning to take it seriously, but it's very slow. So the employers need to sort of work to stop the health getting worse and to allow the employee to continue to work through, the kind of jobs that they have. And I think that we have typically separated out work and pensions from health, and there is this interdependency that we need to put back. It's a little bit like the good jobs agenda more generally. Carol was saying, you just need a society where sort of lifelong health and well-being are promoted from the start, and employers do their share, and governments do their share, and healthcare systems do their share. And that needs to work at the bottom for people with low skills and kind of manual occupations as well as at the top. So I think sick leave is a sort of canary in the coal mine for some of this stuff, actually.
Can I add to that I did a review of I was looking for policies that are good, internationally good supporters of people in work when they begin to have chronic illnesses. And there are actually very few countries, even within Europe and even within the kind of best end of the European welfare state programs, there are not many countries that actually have any kind of systematic policies towards employers supporting individuals to stay in work. It's partly, I think, because historically employers have wanted to get rid of problem individuals, and those problem individuals are kind of people who can't function as well as they could. And now, of course, they're people who have mental health problems. Now, with, I think, mental health problems, there's so many of them that employers can no longer pretend they no longer exist. But I think there really aren't very many. You can look at a few Scandinavian countries for good policies around supporting people who begin to be ill in staying in work, but there really aren't many. I'm not aware of any in the US that I came across when I did this study. There may be in some occasional states or some good employers, but it's a very neglected area.
So if I could kind of return to the little bit narrower question that I think you started us with about COVID and how that all plays in. I have actually some thoughts and advice here. One is, to the extent there have been changes in economic incentives, policy changes related to COVID, like increasing the generosity of sick leave, those will obviously, we'd expect those to have predictable effects. But beyond that, my thought is, and I know this isn't so comforting for policymakers, we need another couple of years to understand how this is all going to play out. I mean, this was a major, major shock in so many ways, and we don't really know yet. You know, are we at some new steady state, or are we, you know, is it kind of a temporary shock where we're going to return to sort of more or less where we were? So in terms of changing policies with regards to sick leave, longer term policies, because of the COVID shock itself, I think we want to wait a couple of years and you know, have some time to really figure it out. For the broader issue, I want to point out that we want to be careful. I mean, yes, probably there are things employers can do to support the health of their employees, but you know, the evidence, like there are these workplace health promotion programs that have not been particularly successful. So yeah, it'd be great if, you know, there probably are some things employers can do, but just saying, you know, just have employers do a bunch of programs, maybe we're going to government subsidize these programs, chances are a lot of them won't work very well, so we should be careful.
Yeah, this is really interesting, and I want to come back to something that David in his presentation stressed very much, which is the need of a big institutional change. But then the question is, how is the political process prepared to come to this institutional change? And you raised three very interesting examples about the shortcoming of the political economy of all this. For example, the wide range of policies that you propose interact with each other. And many of those political decisions are taken in very different places. For instance, in the case of pension reform and labor market reforms, I remember Steve Nicol saying that the problem with pension reforms and labor market reform is that pension reforms are done at the Social Security Minister and labor market reforms in the Ministry for Labor, and both have different objectives, different incentives, and so on. On the problem with sick leave, you have the Ministry for Health and the Ministry for Labor. On the financial instruments to provide income for retirement, financial regulator, the financial industry, policymakers, all of them, again, with different objectives, different incentives, different perspective on the kind of political decision that needs to be made. So my question is, you see this as a very relevant problem, how to adapt the political process to make possible this big institutional change that I think David is right, we need very, very urgently.
Yeah, so just on the institutional change, I actually think the major problem in most countries is the political cycle is 4 to 5 years, and the payoffs to these changes are much more long-term. The costs are short-term and the benefits are long-term. So from a political perspective, it's always better to let the next government deal with this. And eventually, if you do nothing, you actually do get a sustainability crisis. It actually becomes actually unsustainable and breaks down. It's much better to do things gradually, but I think the political incentives don't align. The one country that I cut from my talk because of time is Singapore, which I think has good policies that people should study and emulate. But the Singapore political perspective is they have a 50-year plan, and it's a very serious 50-year plan. And they're willing to take short-term costs because they assume they will be in power for 50 years, and they will have to face these problems if they don't. So I think the major issue is aligning the political incentives with the long-term incentives, and I'm not sure how to do that. But I think that I think politicians will realize that these are problems, but politically the cost of doing things about them, as we see now around Europe, is so high relative to the long-term benefits being in the future.
Aligning without creating a dictatorships, I would add, because...
Nessie, please.
Regarding sick leaves, I guess one effect of COVID could be, the issues about flexibility, work from home, health, all these become more salient. So as a result, the increase, of course, there's the moral hazard problems, but it might not be a bad thing, going back to David's comment on welfare. So maybe before COVID, some sick people were felt, they had to show up, and now people are much more, feel more free to express their health needs. But again, this is always a double-edged sword because of the moral hazard problems, and we have to think about how we overcome that problem. But there is that aspect that I think the demand for flexibility has increased in the post-COVID world somehow.
I would like to follow up on Nessie's point. I don't understand your argument, because it seems to me that the flexibility brought about by teleworking allows people to basically stay home, stay in bed, have a cup of tea, or go shopping without having to resort to sick leave. And so somehow you would imagine that the possibility of substituting sick leave for this would reduce the incidence of sick leave rather than increase it.
Days that they work home for work, so that's an assumption. So.
Let me make a final question to the panel. Actually, it was discussed in Tito's presentation. I could see it, but this is one of my recurrent questions to Aitor and the team, which has to do with migration and selected migration or targeted migration. Not necessarily high skill, because actually in Spain now we have a high number of vacancies all across the sectors, independent of the level of skill. So my question is, what is the best practice out there in terms of choosing, targeting migration, if it is any country or any example of good practice? Because as it was pointed out also during the presentations, in Spain, well, depending on the forecast, but we are estimated that around 200,000, 300,000 people will arrive per year over the next decade. So we are talking that in a matter of 10 years, this will be 5% of the Spanish population. So it makes sense to, well, some people would say it makes sense to leave it for the market to decide this 5% of the Spanish population. Other people would say, well, let's target, let's make some analysis, let's try to choose this 5%. But how can we do that at the same time all the other European countries have the same problem as us? Is it going to be a competition for migrants in the near term? You put the question the other way, no? You mentioned that so far in some countries there is reaction to migration, but eventually we will have to pay them to come, and we will have to choose them and make our countries attractive to migrants. No? So what is the best practice? How can we avoid competition?
Well, no, the competition is already there for the talents, and I know very much about it because I'm currently involved in recruitment in a university, and therefore I know, and also the wage inflation which is occurring in that respect. No, at the level we are not yet in a world of competition for lower skilled position, but certainly, and I don't think there is a blueprint, but the type of things that you learn looking at international experience are, one, that you need to have realistic quotas. Quotas have to be there, but you have to decide them with consideration to the demand of employers and above all households, because most of the demand comes from, especially in countries where you have not so well developed long-term care institution and this type of things, there is a very strong demand coming from households. So that is something that you need to take into account. Otherwise, they come in any event and they come illegally, and that creates a backlash against the migrants, so you enter a vicious circle. The second thing is how to fill the quotas. So once you have quotas that are realistic, how to fill them. Here there are various experiences. Both a PBS, so a point-based system, seems to be, in general, the best way to handle this, provided that it is sufficiently flexible that you adjust to changing priorities. So that's a way to really select migration based not only on skill, but also on shortage of workers. There is clearly a problem from the standpoint of origin countries, because it may be associated to a brain drain, but the brain drain effect seems to be less relevant than we thought, also because moving people does not mean moving ideas or preventing these people to send back capital, remittances and other things to the country of origin. Then another very important problem concerning migration policy, but we open a big discussion here, is how to relate economic to refugee migration. And here, this is an issue more for national government, for European policy making, but there are big improvements in this respect.
So I'd just say on migration, if you think about the distortions to the economic system that we can gain from removing, the biggest one in the world is migration. We have now more or less got free movement of goods. I mean, there are still some tariffs, but basically goods are very internationally tradable. There's more or less free movement of capital. The enormous restriction is we don't allow people to move between countries, and we don't allow people who would be more productive in another country to move there, which would be enormous economic and welfare benefit to them, and I think to the receiving country. So this is the biggest distortion in the world. So addressing it, I think, is got the biggest potential welfare gains. I think it is difficult, and there is work in the US that shows that the low-income groups, low-education groups do suffer from migration. There is competition of migrants for those jobs. And so the distributional aspects of migration have to be addressed. There's also, I think, this national question: who are we? Whose welfare are we maximizing? And with migrants, you change your denominator in a sense. Who's in the country? So, for example, Singapore is very keen on short-term migration, both of low and high-skilled people, but it's very difficult to settle permanently in Singapore. So I really like migration, but I worry that unless you address the political consequences, and I disagree with you a little bit. You thought the anti-migration was a sort of lack of information. And I'm not sure about that. I think the anti-immigration feeling is that there are real costs to migration, and that you have to address the real concerns of people about their own wages and well-being, and about pressures on social security, pressures on housing. But I think if you do address those, it's a potential win-win with enormous welfare gains. The wage gains people get from migration are just enormous. And if they can be shared to compensate the losers, which is the standard economic argument, you can get enormous Pareto improvement.
Just to clarify, no, I never said that the problem of migration is related to lack of information. I simply said the link between pension and migration are a matter of information, which is only a very small component of a problem. Most of the cost, welfare cost for the domestic population of receiving migrants are related to amenity values, are non-strictly economic, are not related to the labor market. This is what the survey tells us very clearly. So in that respect, I think that migration restrictions are welfare enhancing to some extent. So getting gradualism in migration is something very important from the standpoint of a well-being of the receiving population. So having some restriction is needed, is welfare improving.
I think anyone on this topic? And the audience and here at the table? Almost last chance to speak.
You can hear me? Yeah, okay. Very quickly. I see migration solving shortages, labor shortages, okay? But what I don't understand very well is the relationship, or if we are talking about migration in this today, basically is because we think of migration as a solution for pension, the pension system. No, but what I didn't understand from Tito's presentation, it's good that you are leaving, is basically that these guys are contributing, but they are also gaining rights. So I'm not sure whether these dynamically are going to improve structurally, no, the problem. So to me, it's kind of a mistake, no, trying to see migration as a solution for the aging, but maybe I'm mistaken.
Okay, so I'm enjoying a lot this round table. I have many more questions. Perhaps we can address them at dinner, but all nice things come to an end, so we need to close this round table and the conference. As our governor said at the beginning of the conference in the opening remarks, we have been extremely happy of hosting this event here at Banco de España. A special thanks to all the speakers for their participation in the event and also in the round table. Thanks also to the organizations supporting the event, CEMFI, Georgetown University, our internal staff organizing all the details, and also thanks to the audience for the very active participation in all the sessions and in the panel. Thanks a lot, and enjoy dinner.